Hello everyone. Re the Explorer here. Today's topic is an update on birth control. I go into detail about the specific hormonal composition of most of them, including who can use and what to use in what situations. We know there are several forms of birth control, and different ways it can be administered. These include oral pills, vaginal rings, injections, intrauterine devices, IUDs, and more. The most important thing when discussing birth control with your healthcare provider is letting them understand your medical history, mental health background, pregnancy history, and past birth control experiences. For example, if you have a mental situation, hormonal pills or hormonal preparations might be avoided, since we know some of them affect moods, a marker related to mental health. It's also essential to let them consider your lifestyle and social situation. For example, if a woman has a very busy schedule and struggles with consistency, a birth control pill that needs to be taken daily may not be the best option. When a birth control method is not convenient for a person's lifestyle, they are more likely to discontinue it, which increases the risk of unintended pregnancies. Let's start with the age-old birth control pill. This needs to be taken daily, preferably at the same time each day. Keeping hormone levels stable is crucial because even missing a pill by 12 hours can lead to ovulation and therefore contraception failure. There are different formulations of pills, including progesterone only and combination pills with estrogen and progesterone. Not all pills are suitable for everyone. For example, women with migraines, irregular menstrual cycles, or heavy periods may need a specific type of pill. Next, we have Depo-Provera, an injection taken every 3 months. Some women worry about weight gain with this method. The reason for potential weight gain is that Depo-Provera contains progesterone, a hormone that increases during pregnancy, stimulating appetite and sometimes causing water retention. These same effects can occur while you use Depo-Provera injection. However, maintaining a balanced diet and monitoring food intake can help manage weight gain. There are also concerns that this method might lead to infertility. As much as this is anecdotal evidence, my opinion is that where there is smoke, there is fire. Keep it off if you really want to have a family. Some women find it inconvenient to visit their doctor every 3 months for an injection, so this method may not be ideal for everyone. But at least there is no need to worry about protecting yourself against pregnancy on a daily basis. In my many years of work experience, I have seen that women who already had several children select this method very often, and I do understand that. Another option is the birth control patch, which contains both estrogen and progesterone. One example of these is Evra patch. However, weight can impact its effectiveness. Women over 90 kilograms or about 200 pounds may experience reduced efficacy. There are newer patches available that can accommodate a higher weight range, but for women over 110 kilograms or about 250 pounds, this method may not be the best choice. One major downside of the contraceptive patch is that it may cause an increased risk of blood clots due to the estrogen in it. This may lead to increased risk of medical problems such as deep vein thrombosis, DVT, stroke, or heart attack. People at risk of these medical conditions, as well as hormone-related conditions, should avoid hormonal patches. This is one main reason why a complete medical history is taken before deciding which contraceptive method is good for you. Condoms and spermicides are barrier methods. When used correctly and in combination, they can be an effective form of birth control. Additionally, condoms are essential for preventing sexually transmitted infections, STIs, especially for people with multiple partners or those in relationships where their partner may not be monogamous. Another option is the vaginal ring, commonly known as Nuva ring. This is inserted into the vagina and stays in place for 3 weeks. It contains both estrogen and progesterone. After 3 weeks, the ring is removed to allow for a period. In many contexts, a vaginal ring is placed and removed by a healthcare provider. This is an excellent option for female commercial sex workers. Nexplanon is a small rod implanted in the arm that releases progesterone. It is commonly referred to as contraceptive implant. It can last for up to 3 years, and some studies suggest it may be effective for up to 5 years. Many women prefer this method because it requires no daily maintenance. It also has the highest efficacy among birth control methods since there's no risk of forgetting a dose. One downside of Nexplanon or implant and Depo-Provera is that they may cause irregular menstrual cycles initially. However, after the first 3 months, many women stop having periods altogether, which can be a benefit for some but a source of worry for others. The period should return after stopping the use of these contraceptive methods. But as I said earlier, Depo-Provera might delay the return of periods for quite extended periods. IUDs, intrauterine devices, are another long-term birth control option. There are hormonal and non-hormonal versions of the IUD. The non-hormonal option, Paragard or Copper T, contains copper and works by disrupting the uterine environment to prevent pregnancy. Used as a contraceptive method, it acts by mechanically preventing pregnancy as it sits within the uterus. In some cases, it can be used as emergency contraception by mechanically preventing implantation. However, this is controversial. Hormonal IUDs contain progesterone and may cause irregular bleeding at first, but many women eventually stop having periods or have heavy periods with cramping. Although rare, pregnancies can occur with an IUD in place, often due to displacement of the device. Choosing the right birth control depends on your lifestyle, medical history, and personal preferences. When discussing options with your healthcare provider, be sure to mention how much involvement you want in your birth control routine. The best method is one that fits seamlessly into your life and medical needs, ensuring consistent and effective use. Although to a larger extent, contraception is a woman's business, be sure to involve your male partner or partners, because experience shows that this makes things lighter. I really hope I was able to add value to your situation. If I did and if I did not, please write me in the comments section. Remember to keep it safe and healthy. I do hope this was helpful. Don't forget to like and subscribe for more topics like this. See you next time.